People, let us look at this Richter's hernia in this. So basically what happens is normally you will have a sac and into it the bowel would have come, isn't it? This is the bowel contents. It would have come into the sac. This is normal. But in Richter hernia, how it will be, only the part of the circumference of the bowel would have come inside. See, something like this. So this will be a Richter's hernia. Only part of the circumference of the bowel would have come inside. So now what will happen in this case, there can be a constriction ring here, there can be obstruction, and this entire part can undergo gangrene. But here what will happen, there is no obstruction, isn't it? The bowel pathway is not obstructed, but this portion can get this portion can get strangulated, guys. Just remember here, the obstruction, there's no obstruction, okay, but there is strangulation. Where? In Richter hernia, remember. This is when part of the circumference of the bowel is undergoing hernia. So this may spontaneously reduce, looks like by itself. Gangrene may be overlooked at operation. So don't overlook the gangrene. There still can be gangrene, though one side is fine, the other side may not be fine, okay. Even though the patient has features of intestinal obstruction, there will be diarrhea, blood in stools. Did you understand? Even though the patient has features of intestinal obstruction, there will be diarrhea. That means there is, you feel like there is obstruction, but actually he is having diarrhea. Did you get it? That means there is no actual obstruction, but this guy has diarrhea and blood in stools because of all that strangulation, isn't it? So there is some kind of a partial obstruction. There is a rapid movement of the content, diarrhea. So you should not confuse with other causes of diarrhea also in Richter hernia. That is another thing. So in femoral hernia, usually what will happen in femoral hernia when it is coming out of the what is that? Femoral ring, femoral what is that? What do you call that? Femoral canal, isn't it? So whenever it is coming out of the femoral canal or the femoral ring, so there is a femoral hernia. There you can see more of such Richter hernia. Obturator hernia, where it is coming out of the obturator canal, right? Here you can see the femoral ring and the this is the femoral ring, right? Femoral ring and femoral canal. From this there will be femoral hernia. So it is possible that a part of the circumference of the bowel can come, Richter hernia. Here you can see the bowel coming through the femoral canal, right? Femoral ring, femoral canal, and also the, what is this thing called as saphenous opening, right? So here you have the obturator canal through which it can come out. That also can be more like a place for cause of a Richter hernia. See, they are showing here obturator hernia. Where do you want to see some? This is their obturator canal through which it is possible that a part of the bowel can come out. Okay. Means what I'm saying is part of the circumference. Yeah, that's the right statement. Part of the circumference of the bowel is coming out. Okay. So there will be no obstruction, but there will be strangulation where Richter's hernia, where is it more common? In femoral and obturator type of hernia, it's more common. Okay. So gangrene you should not overlook. It may be there somewhere, though on one side of the bowel it's not there, somewhere it will be hiding on the other side. Okay. That these people will have diarrhea and blood in stools.